of you, and this is my first vlog, and this is about um, the precautions that you need to take after the surgery is done for the anal fissure. Okay, so yesterday I had my surgery done, laser surgery done for anal fissure. Okay, and um, so this is a video which um, tells all the precautions that you need to take after the surgery, and whatever is the scenario and what are the situations that you face after the surgery, because on the internet I could not find any relevant video or um, forum or content that exactly speaks about what should be the precautions. However, these precautions are told to you by your surgeon, but this blog is for those who are planning to take up the laser surgery for anal fissure and are looking out for what would be the exact scenario after the laser surgery is done. So a little bit of background before I start up with the 16 points that my surgeon has given me um, for as the precautions that I need to take after the laser surgery is done. However, these precautions were not disclosed to me before I take up the surgery. He said that the very next day you'll be able to go and resume normal day-to-day life, and can join work, and you can start the daily routine. However, that is true to an extent. I mean, it's like it's not painful. Okay, after that it's not, because you anyways are on painkillers and antibiotics after the surgery. So I guess you can resume your day-to-day work and life. And however, I am self-employed, so I've chose not to go to office and work from home for a couple of days, because since it's been 24 hours now that my surgery is done and still I've not passed my stools. However, in the post-surgery notes they have mentioned that it may take about around 3 to 4 days in some cases for you to pass your first stool after the surgery is done. Okay, so um, yeah, so talking about my background, so I'm suffering from the anal fissure since around on and off since around 4 to 5 years now, and it was the last step. I've tried everything: allopathy, homeopathy, Ayurveda, and all other different things before I chose for a laser surgery to be done. Okay, and I've taken this surgery here in Mumbai, and it's in Mumbai, India. It's costs around 65,000, because on the higher end, you might find different hospitals and different surgeons who do it for a cheaper rate. However, I thought that it's a one-time cost, and I might get it done from the best surgeon itself. And even though he was a bit expensive, I thought to go and take the surgery done from the surgeon itself, because he had claimed that whatever cases that he has taken. Okay, so uh, there the ratio of the recurrence was none, and in none of the cases that the patient has complained that the problems are recurring. Okay, and also the second point that the surgeon told me is that in case um, this problem of anal fissure or bleeding again appears, then he would treat me for free after that. So I just thought that I should go for this. And yeah, and he had given me a sheet earlier as well, saying that what are the advantages of laser surgery compared to the traditional technique, that is LIS, and in which they cut you and this and that. But however, this new laser technique is very is blood free, and it does not have any precautions that you need to take, or any diet that you need to follow after the surgery. Okay, so even the non-veg consumption was also allowed after this laser surgery. So I thought that I should go for the laser surgery rather than the you know the traditional technique. Even I would not recommend the traditional technique. I would just recommend to all of you that the laser surgery is much better than the LIS technique which is there, and because it takes around 12 to 4 to 12 weeks as they claim for the LIS technique, for you to get healed. Okay. However, these are the things that the surgeon had claimed before my taking up my surgery. However, after the surgery, things are not that different, but yes, are a bit different. First thing is that it's been 24 hours now that I am done with my surgery, and yes, I have not passed my stools yet, so I won't be able to tell you the exact comfort or discomfort, but there is no pain since I am on antibiotics and painkillers, and there's no pain as of now. I just passed gas, and there's a few liquid discharge, I can say. I can feel that my skin tag is removed, however, I'm not touched that area yet, so I can just know that the skin tag is removed. And also, earlier when the surgeon used to claim that it's gonna be a bloodless surgery, after the surgery, I found that there's a bit of dressing there. Dressing meaning there's not tape or anything, just a bit of cotton which is kept there for maybe since my skin tag is removed, that's why the wound was a bit so sore. And because before taking the surgery, I had seen some YouTube videos in which they are treating anal fissures with laser, and once if there's a bleeding fissure, um, I saw in the laser technique that the bleeding would stop as soon as the laser was used over it. So, but I was expecting the same, but there was some difference, and in my case, there was a bit of dressing which was there, and after that also, since a continuous process, since 24 hours, there is sometimes in couple of hours there's a discharge, liquid discharge continuously coming out from there, and so I don't know what exactly is that, but yeah. So in case you need any other information about my background, then I'll just give it to you. However, I'll let you know that I'm 26 years old, and I've been suffering this from the age of 21. Okay. Um, yeah, I know that it's a very young age to have these problems. However, this problem had occurred because of my irregular sleeping cycle and bad eating habits that I had. Okay, that is consumption of too much non-veg, alcohol, and all those things. Right. So let's moving on. We can just go to the steps that you need to follow and the care that you need to take post the laser surgery. I'm making this blog because nowhere on the internet I could find a proper blog or forum or video which would actually tell me the precautions I need to take after the laser surgery is done. So these are the facts which are given by my surgeon. So I would just like to read it out to you so that before taking the surgery you are familiar to what will be the scenario after that. Okay. So starting with the first point, they have mentioned avoid constipation at all costs. Second point says that do not strain at stools. Wait for the urge to come. It may take some time, but it will come. In some cases, it may take up to 4 days to pass motions. After passage of motions, for the first time after laser, pain will increase, and lidocaine jelly should be applied as stated. Okay, so the first time they have claimed that the first tool would be painful. However, there will be local anesthesia jelly which will be provided to you. I have got a Lox 10% spray that I need to use before and after passing my stool, so that there's a local anesthesia and I cannot feel the pain. Okay, so and the sixth point that I mentioned is that um, regulate passing of stools by going to pass stools as and when the urge comes. It may be in office, even then use the bathroom. Okay. The seventh point is have a high fiber diet and 2 bananas and 2 chikus per day. This will be a lifelong habit. Use crema diet powder 2 teaspoons in glass of milk at night for 1 week. Liquid paraffin 1 teaspoon in night for 1 week. Tablet Ziplocs. Tablets are again, yeah, these are antibiotics 500 mg, one tablet twice a day for 3 days. Okay, and then there is Ultraset, one tablet thrice daily for 5 days. And Ultraset is again a painkiller. So the Ziplocs, the antibiotics you are taking twice per day, and the painkillers you are taking 3 times per day. Okay, and there's the lignocaine jelly that locks 10% jelly or 2% jelly, which comes, and you can either use it by squirting it inside the anal canal or applying it with gloves as when pain appears. It is important to note that lignocaine jelly has to be applied inside the anal canal, and there will be slight pain on application. Do not pull any threads. Okay, and then they have written that maintain local hygiene as required. If you have been using local ointments, then you may experience more pain after passing motions for up to 7 days. Itching may come after 3 to 4 days, up to 14 days. Apply xylocaine jelly and take Avil 25 mg for a couple of days till the itching passes off. Okay, then there's the candid cream may also be applied for some days. And then the last point is the dilatation. Okay, dilatation is required for recurrent cases after 7 days for 6 months. Please contact after 1 week of mentioned by Dr. Klee. And again, after this surgery, I have been called after 1 week for the follow up with the surgeon. Okay, um, and yeah, so these are the precautions that you will need to take in case you know missed out on any. You can just rewind this video and listen to it carefully and then jot all the points down. Okay, so I'll try to make another blog which has these things written in writing, and also post a photo of the discharge sheet that I have got uh, directly onto the internet. Okay, so this is it. Hope that this video helps you, and yeah. mm, and in case you have any queries regarding the surgery, um, you can just comment it below. However, yeah, so I had taken my surgery on the 3rd of Jan 2017, and it's been just 1 day. And the surgery started at around was scheduled at around 11:30. However, when I moved to OT, it was around 12 o'clock. When I opened my eyes, it was around 2 o'clock or 2:30. So it was a couple of hours in anesthesia, and yeah, 1.5 to 2 hours in anesthesia and sleep. So then after that, then they claimed that the surgery would take around 15 to 20 minutes only. I don't know in my case how much time did it take, but because I was under not local anesthesia but complete anesthesia, so I just remember that I had slept in the OT and then woke up at the ward. Okay, and then they had kept me for around till the evening 6 o'clock. They had kept me, and then after was discharged the same day. Okay. Um, so as soon as you're out of the OT, you'll be feeling very sleepy due to anesthesia, and then yeah, so for a couple of hours, even after you wake up, you're not allowed to take anything, not even water. Okay, and before the surgery also, you're not even allowed to take water. Okay, so after the surgery, around a couple of hours you're not allowed to take water, but after 2 hours you'll be asked to take half a glass of water to just see that if you're feeling any vomiting sensation or anything. If you are feeling okay, then you are allowed to take fluids inside. Okay, you are allowed to eat fluids or solids as well, but I just stick to fluids. And then in the dinner, because I have to take the antibiotics and the medicine, yeah, so I had taken solid diet then. Okay, so in that case also as well, a lot of solid diet should be also be, it should be watery. Okay, it should not be too hard, or do not consume. I would not recommend you to take non-veg or anything. Just light dal and rice would do. Okay, so in case you have any other doubts, you can just post it on the comments. I'll just reply them back to you. In case I have missed any point, I will, reply it out on the comments. Okay, so in case you need any other reference, feel free to ask all your doubts and questions to me. Um, that's all for today. I'll be again sharing my experience, as when I passed my first tool and after the first follow-up is done, so that we'll have a clear picture and idea. So my follow-up is after 1 week, so hopefully I'll be um, uploading 2 more videos until then. Okay, so have a nice day, guys. Bye.